Welcome to the Collaborative. We're here today to talk briefly about perinatal mood and anxiety disorders, specifically the impact of untreated depression and anxiety on a pregnancy. My name is Sarah, and I'm a dual-certified Psych NP and actively working midwife. Today's presentation is intended to be a brief educational video. It's not meant to replace the full risk discussion you're going to want to have with your medical provider. We have no financial disclosures, and all presenters for the Reproductive-Psychiatry-Collaborative are non-paid volunteers. We need to start out with that perinatal mood and anxiety disorders are common. It's actually the most common complication of childbirth. 1 in 5 birthing individuals will be affected by a mood or anxiety disorder, either in pregnancy or up to 12 months after delivery. Perinatal mood and anxiety disorders, or PMADS, is a term that includes depressive, anxious, and bipolar disorders, as well as postpartum psychosis, which is considered a psychiatric emergency. It's important to know that feelings are natural and they're not pathological in and of themselves. Our primary concern is if your mental state is starting to impact your physical, emotional, or social well-being to the level where it impacts your daily function. This is why baby blues is not considered a psychiatric disorder. It's a temporary period of mood sensitivity that affects most birthing individuals after delivery. It can present with mood swings, sadness, crying, irritability, anxiety, and poor concentration. These symptoms typically do not last longer than 2 weeks, and it should not prevent you from taking care of you or your family. If your difficulties with your mood and anxiety persist after 2 weeks, or if your feelings are so profound that your quality of life for yourself, your family, or your baby is impacted, then this could be signs of something more going on, such as a perinatal mood and anxiety disorder. So let's look at disorders that fall under the term PMAD. For some, their mood looks like depression, which can manifest as low mood and energy, feelings of hopelessness, sadness, worthlessness, or guilt. It can be accompanied by poor sleep, changes in appetite, and crying. In moderate to severe cases, individuals can neglect their own needs or have thoughts of self-harm or harming others, and this includes thoughts of suicide. Sometimes emotions look like anxiety, which manifest as distressing, intrusive thoughts, feelings of fear, worry, or panic. It can be accompanied by rapid heartbeat, difficulty breathing, irritability, restlessness, poor sleep, and changes in appetite. It can also include distressing, obsessive thoughts that are relieved by behaviors such as checking, cleaning, or rearranging. It's important to note that depression and anxiety often occur together, and individuals can present with both sets of these symptoms. Bipolar disorder often looks like depression. Postpartum, it can have additional symptoms, though, that manifest as really high energy, maybe really, normal energy, but with little to no sleep. Fast pressured speech, restlessness, irritability, and unusual self-confidence are actually common. Individuals can feel as if they can accomplish anything, producing unusual behavior that others might think is excessive or foolish or risky. These symptoms are described as mania or hypomania. When depressive and manic-like behaviors occur at the same time, there's an elevated risk for self-harm or harm to others. This includes suicide. Individuals are also at higher risk for the next condition. Postpartum psychosis is one of the few true psychiatric emergencies. It is rare. It manifests as unusual thoughts, confusion, paranoia, or seeing or hearing things that other people can't. Most importantly, it comes with a high risk for harm to self and others, and in rare cases, this can extend to the baby. Individuals with postpartum psychosis need intensive therapy and medication to be well, and this level of care often requires hospitalization. Typically, the one sounding the alarm is actually family members because the individual doesn't realize they're unwell. So if your family is concerned, please listen to them and reach out for help. So now let's talk specifically about why your thoughts really matter in pregnancy. Your mental health can have profound physiological, psychological, and social impacts for you, your family, your work, your overall health. So think about when you're afraid. Your heart rate goes up, your blood pressure goes up, maybe your hands start to sweat or you're having a hard time catching your breath. These are physical reactions to an emotional state, and there are many reasons why this happens, but it's important to understand that your mind and your body are truly connected. This is why untreated anxiety and depression can impact not just you, but your pregnancy and your child. Untreated anxiety and depression is associated with increased risk for preterm birth, preeclampsia, and gestational diabetes, and each of these conditions in and of themselves have multiple downstream effects on your health and the health of your baby. In addition, untreated illness is associated with drug use, smoking, missed perinatal appointments, self-neglect, self-harm, and suicide. For babies, untreated anxiety and depression can lead to elevated risk for low birth weights, low APGAR scores, which is a measure we use that's associated for an infant's transition into life immediately after delivery. They can also increase the risk for admission into a neonatal intensive care unit, resulting in longer hospital stays and obstetric complications. Maternal depression and anxiety is also associated with lower IQ scores. Anxiety can impact the development of a child's working memory, and this can lead to children having delays in cognitive and motor development, along with long-term risks for children having difficult temperaments, behavioral problems, mental health problems of their own, such as anxiety, depression, and ADHD. So even after pregnancy is complete, untreated anxiety and depression can affect the postpartum period by impacting breastfeeding, sleep, and putting undue stress on the family and impairing the maternal-infant bond. The relationship between a baby and a birth parent is profoundly important, and impaired bonding can have long-term neurodevelopmental impacts on baby. Most importantly, those that have difficulty with anxiety and depression, both in pregnancy and postpartum, are at risk for thoughts of self-harm and suicide. This is a common problem. It's just not commonly talked about. Please remember, you are important, you are needed, and you are not alone. With treatment, you can be well. Treatment for perinatal mood and anxiety disorders can look different for different people. Sometimes this is psychotherapy, sometimes it's pharmacotherapy, sometimes it's both. If you've ever had thoughts of harm for yourself or others, support is available. It's considered a psychiatric emergency to have any active plans or intent to harm yourself or someone else. Please reach out. These supports want to help you. The National Maternal Mental Health Hotline is a number you can call 24 hours a day, 7 days a week for free, confidential, understanding support and resources. The National Suicide Crisis Lifeline, 988, can also be called anytime, day or night, for supports with thoughts of suicide or self-harm. In addition, Postpartum Support International, the Maternal Mental Health Leadership Alliance, and Marseille of North America are 3 organizations that are tirelessly working towards improving maternal mental health and in providing support, education, and advocacy. Thank you for giving us your time and watching this video, and please do not hesitate to reach out with any questions. Please also consider joining the Reproductive Psychiatry Collaborative, because your thoughts matter.